All right, good morning, everyone. We're going to get started. Thank you for attending Humana's on-hand product training. I do have to go over a few slides first, just for housekeeping. First, if you have any questions, please type the question in the question box as shown on the screen. Your phones will be muted throughout the webinar, but if you have a question, you can type it there. And at the very end, we'll have a short Q&A at the end of the presentation. My name is Beatrice. I'm a broker advisor for Cornerstone, and my phone number and email are there. If you need that, you can jot it down. Cornerstone is actually running an incentive program again for 2021 with all new prizes. Qualifiers will have a chance to win up to $5,000 and a travel voucher for a weekend getaway to a destination of your choice. Brokers qualify by earning points for new to Cornerstone group and individual medical and ancillary sales, a minimum of 2,000 points to be eligible for a cash reward and chance to win the bonus weekend getaway. Top 20 qualifiers earn cash. Brokers must register online in order to participate. And the point earning period is from January 1st, 2020 through December 31st, 2020. Lastly, as we all navigate through the COVID-19 pandemic, carriers and legislative leaders are issuing guidance and information regarding the virus. Please visit our coronavirus information pages on the Cornerstone website for the latest carrier and legislative updates. We update the page every day so you know that you're receiving the most recent information. Now, let me turn it over to Humana's Leslie Iser, Casey Badura, and Tyson Brown to go over the on-hands product.
Good morning, everyone. Go ahead and get my screen set up here.
Yes, we can go ahead and see that.
Okay. My name is Leslie Eisler, and as Bobby said, I have Casey Badura, who is your Humana Retention Executive on the line, and Tyson Brown, who is your Inside Sales Executive for Humana. So you may hear them chime in throughout the presentation. We're really excited to introduce On Hand. It's an innovative new health solution for your clients. One great thing about working for Humana is we may not be the biggest carrier, but we definitely have innovative solutions and come up with new ideas. So before we get started talking about On Hand, I wanted to make sure that everybody understood the premise of our level funded premium product, because it actually is on the chassis of level funded premium. On Hand is considered ASO, and it follows a lot of the same rules. There are a few differences which I will point out, but wanted to make sure that you understand how level funded premium works. Just to start out, level funded premium is available for groups with at least 5 enrolled and up to 99 for the maximum. So what we consider our small group chassis, but you do have to have at least 5 enrolled. Chamber discount is available for level funded premium groups. It may vary a little bit if you have a primary site multi-location, but if everybody's local here, it is available. And it will be available for On Hand. So just wanted to make sure you know that. For level funded premium, the Go 365 small group wellness incentives apply. The mall rewards are included, and this will be a little bit of a difference with On Hand, but we'll talk about that. Standard clinical programs are included. Doctor on demand, which you'll find out with On Hand, is a big part of it. For level funded premium groups, have a zero copay for telemedicine as long as it's a copay canopy or simplicity plan. The whole premise behind level funded premium is really to mitigate the peaks and valleys of a true ASO product, but yet to save an employer money on taxes. So it does save them a little bit of money. It is considered ASO, but the employer will pay the same amount each month. There's no downside risk, so even if an employer goes above their aggregate attachment point, there is no money that they're going to owe us at the end. There's just an upside where they do have the potential to get money back at the end of the contract if they have ran well. All of our level funded premium and On Hand products for this area will be a $15,000 specific, and the claims fund will be funded at 110% of the aggregate. or of the expected claim, sorry. The contract is a 12/30 contract, and the way the settlement works is 3 months after the plan year ends, we will look to see how they ran. If they have money left, we're going to keep 6% in reserves to pay claims throughout the end of the contract period. We'll continue to pay claims for 18 months after the contract ends. For level funded premium wellness incentives received during the period, those are subtracted out because you're paying less towards the claims cost. Claims surplus will be in the form of an administrative credit on the invoice, and you have to renew to receive that credit. The group has to renew. Just some rules of the road. Participation, again, we need at least 5 enrolled. We don't have a minimum participation percentage that we're going to look at. If an employer has 5 to 9 enrolled employees, they can actually have a dual choice. And 10 plus, they can have up to 3 plans. If you have a situation where you want to do, you're going to use the chamber, Cincinnati Chamber, you may want to talk to your Cornerstone broker sales representative about how that will work, because we cannot have any more than 3 plans. And so we'll want to make sure we talk about that if there's people out of the area. Plan changes can be made at renewal. We want the paperwork no later than the 5th of the month of the requested effective date, but I will caveat this by saying it takes a little bit longer to set up level funded premium plans. On-hand plans are considered ASO. So if you don't have it to us until the 5th of the month of the requested effective date, it takes about 10 business days, 7 to 10 business days, generally around the 10 business day mark, to process the level funded premium plans. So we recommend you get them in as quickly as possible. One thing that I want to point out, state continuation is not available for this product. So COBRA administration, employers with 20 or more, just like the rules today, can have COBRA, but if they have under 20, because this is ASO, state continuation is not available. So keep that in mind. And I don't think that's any different than a lot of our competitors. Reporting, so the employer is responsible for the PCORI fees. And everybody knows they've been reinstated and what the chart is as far as what they have to pay per member per month. But what we do is we have a membership report that the employer group can pull to get the numbers that they need to report to pay that PCORI fee. Humana does process 1094 and 1095B forms for groups with under 51 on payroll. There's monthly financial reports that are sent out, and it'll have what we've paid out and give you an idea of what we are paying in claims and if there have been any stop loss hits. And then we also suggest that all employers register for the New York surcharge pool. And then there are some SIC codes that are not eligible for level funded premium, and those are listed here: public administration and municipalities, some PEOs and employment agencies also, and hospitals. Okay. So now we will actually talk about On Hand. So On Hand, as we talk about this, it's really exciting. It's a virtual first primary care plan that fits the way people operate today, or most people, or a lot of people. So most people have a computer, most people have a tablet, most people have a cell phone. It's virtual primary care with board certified physicians through Doctor on Demand. And it's really the first of its kind, offering primary care virtually. And the interesting thing about this product is actually we were piloting this last year, even before COVID. So clearly with COVID-19, the use of telemedicine has skyrocketed. And a lot of people think, oh, wow, gosh, what a great way to come up with a product because of the skyrocketing Doctor on Demand visits. But actually we piloted this in Florida and Texas last year. So it's something that we've been working on for a while. Some of the components to On Hand are unlimited Doctor on Demand visits, and we'll go into some details, but there's no cost for those. So a member can use Doctor on Demand again, as much as they need to, and they're not going to pay anything. There's an app that offers immediate access to Doctor on Demand, so somebody doesn't have to figure out what website to go to, how do I connect with my doctor. There will be an app, and the member can just go straight into the app. Once they're registered, they can click a couple buttons and get to their primary care physician or get an appointment with them. There'll be a care kit that we'll talk about that will be shipped at no additional charge to each member. Common lab and prescriptions are going to be available with just a $5 copay. That would be at Quest and LabCorp. Personalized guidance from a concierge service team. So if somebody does need to utilize a provider in the area, utilizing the National Point of Service Network, it's just something, that they can't utilize via virtually, then there's a concierge service that will actually help them find a doctor in the area, whether it be a primary care physician for follow-up care or a specialist. In-person preventive care is covered in full. So even if you have somebody who needs to see a doctor for a preventive service in the area, those are still covered in full, just like they would be on any other plan today. There's a flexibility to add a flexible spending account or an HRA account to help with some of the costs if they do use a physician in the area, not virtually, and a range of maximum out-of-pocket options for employers to choose from. As we were formulating On Hand, if you think about 45% of uninsured adults say that high costs have prevented them from getting coverage. So how can we help employers with this issue? 70% of doctor office visits can be handled over the phone, and 50% of emergency room visits are for non-emergencies. And then the average on-hand member wait time through the Doctor on Demand app is 5.7 minutes, which, if you go to a doctor's office, if you think about all the time somebody has to leave work if they're in the office, they have to drive to the doctor's office, they wait in the waiting room, then they wait in the room for the doctor. It's probably driving back home, 45 minutes to an hour at a minimum. So it actually saves a lot of time. So let's talk about, I'm not going to review the ASO side, but know that this is available for groups with over 100 on an ASO basis. But I'm going to focus on the level funded premium on hand side of it. So again, we talked about primary care virtually is available at no cost to the member, and it's unlimited. There will be 3 maximum out-of-pockets to choose from, $2,000, $5,000, and $7,900. Just to let you know, the $7,900 is not considered a qualified plan. So the other 2 are, the 7,900 is not. The maximum out-of-pockets will be fixed. It'll be those amounts that we talked about above. It'll utilize our RX5 prescription formulary. And if members get medications in the first 2 tiers, it will be a $5 copay. If members get medications in tiers 3 through 5, it will be the maximum out-of-pocket. So they will actually pay our contracted amount up to the $2,000, the $5,000, or the $7,900. Select labs, Quest and LabCorp, for many, many lab services will be a $5 copay. And then all other labs would be that maximum out-of-pocket. Preventive care covered in full, no matter where you use the service, whether it's virtually or if you're using a local doctor. PCP and specialist visits that are not virtual through Doctor on Demand will be the maximum out-of-pocket. And then a couple things that I want to make sure we point out, because this is a big difference between On Hand and the standard level funded premium product, is that Go 365 and the EAP will not be available through On Hand. So think about the ramifications of no Go 365 means that there will not be discounts available for engagement via On Hand. So keep that in mind. Clinical programs, the base clinical programs are included. And we talked about spending accounts are available and an email address is required for on hand. If you have a group of 5 or more, we talked about earlier, you can do a dual choice. So maybe you want to look at on hand with just a high deductible health plan or a national point of service copay plan. You can do that. So if you think about how it works and the well-being components that are put in there, the member needs access to see a physician. They go to the on-hand app that I talked about, and they can choose their PCP that they're assigned to, or they can actually, if that PCP isn't available for a couple of hours and they really need to see somebody right away, they can just choose another PCP to see right away. Again, it's 24/7 access. There is also integrated behavioral health appointments available. These would not be with your primary care physician, but they are available via the on-hand app. There are disease management and social determinant assistance available, care plans and coaching available via Doctor on Demand, and also via Humana. And then we talked about the Doctor on Demand concierge. So this is also a 24-hour day, 7-day-a-week team consisting of different people within the Doctor on Demand community to help. So there's nurses, nutritionists, social workers, there's pharmacy experts, and then there's that care coordinator who will help if somebody needs to see a local specialist to refer them to that specialist and to help them get an appointment. And that's something that's definitely different than any other product. Spending accounts are available with on hand, and we encourage employers to use the spending accounts. They are not required. An HRA is a great way for an employer to put money aside, the money of their choice, $500, $1,000, whatever that might be, to help employees pay for some of those costs if they do need to see a local physician, and it goes towards that out of pocket. Flexible spending accounts are also available through Humana, where the employee could put aside pre-tax dollars to save in case they do have some medical expenses. And health savings accounts will not be available because there is first dollar coverage for virtual visits, labs, and prescription drugs. If an employer does choose a spending account, again, it is $4 per member per month for both accounts, so not per account, but actually $4 per member per month for the FSA and for the HRA. By default, if an employer elects an upfront HRA account, we'll automatically put $5 in. Clearly, we're hoping that the employer is going to contribute more, but $5 will be the amount automatically put into the account, and then the employer would fund that going forward. They have the choice to do upfront HRAs, to do a back-end HRA, so there are a couple different options within the HRA. And it will show up on the bill as a separate line item so that the employer can see what they're paying for each of those lines. So let's go through an example of how this might work. And we have Mike. He's 61. He's a business owner, busy guy, and he has on hand. And so he's using on hand to coordinate his care through his Doctor on Demand primary care physician. He has his first visit, and Mike first will register on the app. He receives his care kit. So the care kit that we talked about is a blood pressure cuff and a thermometer and a resource guide. So as an employer or as a member calls their doctor's going to have them take their blood pressure, take their temperature. There's some things that are necessary each time that somebody goes to the doctor. Every time you go to the doctor, they're going to take your blood pressure, they're going to take your temperature, and many people don't have these things available. So that will actually be sent as soon as a member registers. So Mike did that. He's got his care kit. He uses the care kit to take his blood pressure during his primary care visit. He talks about that he's had headaches and he's been a little bit fatigued and tired over the last year. So his doctor orders a series of blood tests just to make sure everything's okay. He's directed to go to a Quest or LabCorp near his home, and then he gets a prescription based on the results of his test. So his office visit didn't cost him anything. His lab work cost him $5. He received a prescription that was in Tier 1 or Tier 2, which was a $5 level. And then he has a follow-up visit with his primary care physician through Doctor on Demand. So that whole episode of care costs $10. If you had a high deductible plan, that episode of care would probably cost a couple $100. If you had a copay plan, most copay plans still cost for each one of those things, a couple of office visits, lab work, it's probably still going to cost you upwards of about $100 for all that. So with On Hand, this episode has cost him $10. As I said, there is an app. So the On Hand app, the member downloads it, they register, the member can see their benefits, they can connect directly with their On Hand Doctor on Demand primary care physician. They can look at pharmacy costs, and one of the great things is they can monitor their spending account balance if they have a flexible spending account and an HRA set up. Okay, so the launch kit, I'm actually going to go into the launch kit and show you, and Bobby can send this out to all the participants on the call. So there is a launch kit for agents that we have created, and it has links, which are great. So there's a sales positioning and handling objections, and if you click on the link, it will actually download that document for you. Maybe. Well, it's taking a minute, so I don't want to waste too much time, but you can click on those. Let's see if one of these other ones will come up. There's an on-hand brochure. There's a plan comparison. Try this one more time. There we go. So this just gives you a little comparison, talks about the care, how it works, the 0 visits, the pricing for different services. And then there's also a link in the agent guide to a presentation, similar to the one that I just did for you. And then there's some great videos. So if you just want to send a quick video to a client, 2-3 minutes on how the product works, there's a video that, and I have linked to these. I'm not going to do it now. It might take a moment, but videos that talk about Doctor on Demand and how On Hand works. And then there's also some member information attached to this launch kit. So that will be available for you, and it has everything that you should need to sell On Hand. Of course, we are always available to help Tyson, Casey, and myself. One other thing that I wanted to make sure I pointed out is that with On Hand and with level funded premium, right now, July 1st through December 1st effective dates, each group will get a $150 administrative fee credit per member that they enroll, or not member, I'm sorry, subscriber, now through December 1st. A couple things, and Bobby can talk a little bit more about this, but it does have to be considered, it has to be done through Launch My Group. So it has to be done electronically, essentially. Okay. Does anybody have questions? Bobby, are there any questions?
Yes, it looks like we have a couple questions already in there. Don't forget, if you guys do have questions, you can put it in the chat box and I can read those out. The first question we have is, will subscribers still get physical ID cards?
I have not been asked that question, but I believe so. Oh, go ahead, Tyson.
Yep, they should get physical ID cards. There's no change in the normal installation pieces and like the ID printing that we usually do.
And the quoting process. So now that Tyson spoke up, that's why I have them on the phone. There is no change in the quoting process. So the way we would quote a normal level funded premium group is the way you would do it, depending on if they're in Ohio or Kentucky. There's different rules, but the quoting process is exactly the same.
All right. The next one I have is, what is the price point difference between on hand and a normal level funded product?
So, and Tyson, I was going to say Tyson may be able to chime in. It's hard to compare. So, what I have seen, it depends if you're looking at the 2000 or the which out-of-pocket maximum. It's going to cost. I think the number I saw was a few percentage points more than your standard high deductible health plan, because clearly there's first dollar coverage. So you're giving an employer and their employees a really great benefit with $0 if you use the virtual doctor on demand physician for their primary care needs. So it's a few percentage points more than the closest high deductible plan. And Tyson, I don't know if you have anything else to add.
I would just say from the most comparable plans we have currently in Ohio, it looks like it's around 6 or 7% below that, but it really does depend on which plan you're looking at.
Yeah, we can run a quote. It's available for quoting now for our 7/1 effective date, so it's no problem to have those added on to a proposal.
Hold on here. The next question I have is, how are PCPs assigned through the app?
So a member will actually be assigned a primary care physician once they go through and register. But I believe that they can change that primary care physician, or they don't have to see that primary care, but they're assigned to them once they are enrolled in Doctor on Demand and on hand.
Okay. The next question I have is this an option for current level funded groups at renewal?
It is, starting with 7/1 effective dates. We just need to make sure that, well, if the group is going to be dual choicing, that both plans need to be on our new 2019 level funded plans. Otherwise, if a group is just looking to make a plan change to an on-hand plan, they are able to do that.
Okay, sorry, this next question is a little bit longer. With the new quoting requirement form change with level funded, will this new form also be required for group maintenance? For instance, will new hires be required to fill out the level funded questionnaire, or they need to fill out the 51 Plus app?
So do we know if we're talking a new group or a plan change? Because the group maintenance form is generally, did it say plan change or new group?
I think it's for a plan change.
Because for a plan change, Casey, do you want to talk through that about? I don't think we need apps for that.
No, not for a plan change. So the plan change would just be the normal process with the group maintenance form, and then I know that we will accept a spreadsheet enrollment if there's changes, or if there is somebody that would be coming on to the plan. then we would need the application and be the level funded application.
Okay. Yeah, and keep in mind that with On Hand, we recently made a change back to where if we are quoting a group and they do require individual applications, that they need to, it's not that 51 to 99 application anymore. It is the level funded premium questionnaire. And Tyson, I don't know if you have anything else to add to that.
No, I would just say that if a group's going through installation and they're going through open enrollment during like an installation period, they should fill out health questionnaires through the level funded app, because we can and will re-rate a group in that first 30 days if there's a significant risk that's added on. So just so everyone's aware.
All right. The last question I have is, what groups do you see using this type of plan? I know you said it's been opened in other areas of the country, I think Florida and maybe Texas. So what kind of groups are using it there?
So a couple things that, one thing that I just thought of when I think about what kind of groups might use this product is the virtual visits are not recommended for children under the age of 2. So when you think about who might use this product, if you do have a child, an infant, they can still continue to see their pediatrician. So most of the services that a baby, an infant is going to have, a lot of those fall under preventive care. So the immunizations, the visits, those type of things are still covered at 100% if somebody's using a local pediatrician. They can, for diagnostic care, if they choose, use the doctor on demand physician for a child and pay nothing. If it's diagnostic and they go to the pediatrician, then that's going to go towards their maximum out of pocket. So we haven't seen that there are any particular SIC codes or type of groups using this so far. When we first launched it in Texas and in Florida, a dual choice was not available. So we launched it last June. Once a dual choice was available at the beginning of this year is when it really picked up steam. I talked to the director of sales in Texas. So he said that the fact that a dual choice is now available has made all the difference in the world. But we're not seeing any particular type of group. But I would definitely recommend, if the employer is above 5, it might be a good idea to look at a dual choice situation with just a regular copay or simplicity or high deductible plan, and then the doctor on demand on hand product. So in essence, a long-winded answer to say, we haven't seen any trends with particular SIC codes.
All right. Looks like I don't have any more questions in our chat box. If anyone else thinks of any, they can email me. Again, my information was at the beginning of the presentation. So I just want to thank, Leslie, Tyson, Casey, and everyone that attended the presentation. So, all right. If there's nothing else, thank you guys.
Thank you.